Well, fine. Uh, this is Dr. Zeeshan, and I'll be going through this lecture. Period done. For that's called sports medicine. All right. So we have learning objectives. We have various learning objectives in which it said describe sports medicine, explain the role of sports physicians in the practice of sports medicine, discuss the female triad, describe the pharmacological and legal aspects of ergogenic aids in athletes. Sports medicine. What is the sports medicine actually? Sports medicine is a branch of medicine that deals with physical fitness and treatment of injuries related to sports and exercise. It helps in preventing, diagnosing, and treating the sports injuries. It lays stress in improving the performance of a sports person. Scope of sports medicine, human anatomy and physiology, sports and first aid, prevention of accidents in sports, study of optimal load for different age groups, scientific promotion of sports, role of sports physicians in the practice of sports medicine. A sports medicine physician can diagnose, treat, and manage injuries to your musculoskeletal system and underlying conditions that can affect your physical performance. Educate athletes and non-athletes about injury prevention, nutrition, and safe ways to describe conditions and build strength. Sports injuries, injuries which are common in the field of games and sports, happen during practice, training, or competitions. If appropriate steps are taken by the sports person, the chance of getting injuries can be reduced. As we can see, we have lots of sports injuries in different fields of sports, and for that, we need a specialist known as sports physician. What else we have is classifications of sports injuries. Sports injuries, soft tissue injuries, we have bone injuries as well as joint injuries. You can see here we have a sports physician who is well known in the field of wrestling from India, and he has won. And below we can see the shin injury and the tibial injury. Apart from that, in the bottom picture below, you can see a tennis player stretching it out to hit the ball. Because of that overstretching, we have, you can see they will have problem in the back due to overstretching joint in which it's focusing on the elbow joint and the knee joint and especially the ankle. So these are the ligamental tear, joint sprains can all happen. So we will further study about these soft tissue injuries in detail. So what are soft tissue injuries? We have soft tissue injuries related to contusion, sprain, abrasion, and bruises. So common sports injuries, we have sprain and strains, as we have seen in the last picture here as well. In this picture, it shows an athlete, especially for running, in which sprain and strains, we can have PCL tear, we can have tennis elbow, which is very common, and also fractures. Fractures are really common in compact sports such as rugby. So what we can see over here is a split image of showing two pictures. On the left hand side is tennis elbow, and on the right hand side is the golfer elbow. Tennis elbow, also called lateral epicondylitis, because pain in the on the outside of the elbow. What about the golfers? It causes pain in the medial epicondylis, causes pain on the inside of the elbow. That's a basic definition. Then how will you recognize in the field of medicine if the patient comes to you? Then how will you recognize tennis elbow to with the golfer's elbow? So moving ahead, what we can see is symptoms of tennis elbow. What is tennis elbow? Symptoms are the pain associated with tennis elbow may radiate from the outside of your elbow into your forearm and wrists. It causes difficulty to shake hands or grip an object, turn a doorknob, hold a coffee cup. Symptoms of golfer's elbow: pain and tenderness felt on the inner side of your elbow. The pain sometimes extends along the inner side of the forearm. Pain typically worsens with certain movements. Other symptoms: stiffness, weakness, and numbness or tingling. Moving ahead, we can see the pictures in which it shows the golfer's elbow. What will be the treatment of golfer's elbow as well as tennis elbow? Both the treatment would be similar. We will give NSAIDs, non-steroidal anti-inflammatory drugs such as Advil or LE or simple NSAID that is available off the counter medications. We will do the stretch and do strengthening exercise. We will let him rest from aggravating activities. Consider a brace for the wrist or forearm. Ice the irritated area. Sports injuries and terminologies. Tennis elbow, lateral epicondyle is affected. Golfer elbow, medial epicondyle is affected. Impact on knee and twisting injuries, meniscal tear, ACL tear. We have football injuries, we have ACL tear, anterior cruciate ligament, and tear. So you can see in the pictures above, what we can see on the top corner of there is a rugby player and he has overstretched and now his ankle has pain and his knee is pain. And what happened with the sports? We will have torn anterior cruciate ligament. It's the most common tear in football as well. So you can see in the bottom below picture, we have thigh bone and shin bone, and the ligament has been torn. So contusion, muscle injuries occurring due to direct hit with or without any sports equipment, blood vessels in the muscles are broken, bleeding may occur in the muscles, stiffness and swelling common in the region. As you can see in the picture, muscles may not extend or may become totally inactive. Common in boxing, wrestling, and kabaddi. Sorry for my stammering. Strain, mild or severe muscle injuries. In severe cases, muscle may rupture, may happen during fractures or clash. Sprain, ligament injury may occur due to overstretching or tearing of ligament, occur at wrist or ankle joint. Bone injuries, simple fracture, a fracture without any bone. Compound fracture, along with fracture, skin and muscles are also damaged. Generally, the broken bones comes outside, tearing the skin. A complicated fracture, along with fracture, internal organs like tissues, nerves, and arteries are damaged. Such structures are dangerous and common in high jump and pole vault. Green stick fracture, common in children because their bones are delicate and can bend on any stress. Comminated fracture. That's when bones is broken into two or more pieces, common in cycle and motorcycle races. Impact fracture, fracture bone enters into another bone. Depressed fractures, bones are broken and go down below their normal level, usually found in the skull. Joint injuries, dislocation of lower jaw, dislocation of shoulder joint, dislocation of hip joint. Joint injuries, dislocation of lower jaw occurs when chin strikes to another object, may also occur when mouth is open excessively. Dislocation of shoulder joint occurs due to sudden jerk or a fall on hard surface. End of humerus comes out from the socket. Dislocation of hip joint occurs by putting maximum strength spontaneously. End of the femur is displayed on the socket. Prevention of sports injuries. Injuries are somewhat mandatory in sports. Effect of injuries to the athlete is of extreme nature, as it may bring an halt to their sports career. Taking prevention is always better. Time taken in recovery is the loss of time in training. A sudden injury may be the reason for withdrawal from the competition, which gives a negative impact on the future performance of the athlete. According to the researchers, injury rate can be reduced up to 25% if appropriate steps are taken during training and competition. Female triad, energy deficiency, calories used, calories consumed. Impaired bone health, risk of stress fractures of shin splints, menstrual dysfunctions, irregular or missed periods. What does my periods have to do with my bones? Why energy deficiency and low estrogen is a dangerous affair. As you can see, it's basically telling the triad. If you have energy loss, you have over excessively women are exercising, they will have impact on the reproductive. It means using more calories that you are consuming. Energy is sent to only essential systems. Reproduction is not necessary for survival and therefore it shuts down. When it shuts down, it decrease it, so they will have amenorrhea. Secondary amenorrhea, that is, there will be no periods coming out. Of course, if there will be loss of estrogen. Estrogen is a hormone that regulates our periods. So what happens if the estrogen is not there? Of course, it is very helpful in the structuring and bone structuring and in increasing bone strength. Deficiency of them will cause osteoporosis or decrease building of the bones, and it will have more fractures. Pharmacological and legal aspects of ergogenic aids in athletes. Role of sports supplementation. Almost all professional athletes and many millions of amateur sports take some kind of supplementation. We will move ahead. Why it's what they take lots of supplements because most of our food doesn't contain all the essential elements. Magnesium, to protein, to multivitamins. So they have to take a lot of supplements. So we will further go ahead and see what are they. So what is the recommended amount of calories needed by average person? 2000 for males and 2500 for females, but sports are not average. So people needs more and more. In this, we can see 10 to 18 years have male and female. It shows how they require more and more as they grow up. 10 to 18 required 651 in male and 746 in the female. 18 to 30, 679 and 496. So these are the RMR, that is resting metabolic rate. Further moving ahead, specific calories needed, mostly sedentary, RMR multiplied 1.4, moderately active, RMR multiplied by 1.7, very active, RMR multiplied by 2. Example, 2312 multiplied by 2. Supplementation is designed to either make up for a shortfall in the diet or provide an advantage over your opposite. Role of sports supplementation. Anabolic steroids, human growth hormones, erythropoietin, beta blockers, tetrahydrotestosterone. Creatinine, one of the most researched supplements on the market, theorized to give more strength output for longer during intense short burst exercise, has been shown to give more mass gain. Protein, people use, especially the bodybuilders, they take proteins just to build up because of the increased muscle repair and muscle strength as well. And also they take whey proteins. Whey protein is loved and used by the body the quickest and should also be used for after all strenuous exercise, no more than 50 grams. Antioxidants found in vitamins and in all form of tea, When you exercise, your body breaks down cells during the oxidation process. This leaves free radicals floating around the body, which have been shown to damage muscle tissue and have been linked to cancer. Doping. What is doping? Taking any substance into the body which will increase, decrease the natural functions or performance of the body system. The most common method is drug abuse. In the slide, we can see doping in athletes. We have lots of, first of all, is the Chinese swimmer, which was the most controversial and the most epic recently that has been in the Olympic history. Most of the uh, Australian and other people stepped down and confront him. That was Sun Yang in 2020. He's a famous swimmer and the most famous case of trimetazidine in sports doping involving Chinese swimmer Sun Yang. Then there are Ben Johnson's Marion Jones. Then the most famous is Lance Armstrong. He was a seven-time world champion for French cycling competition. Tour de France, as we said. And what they used to do, people used to get the whole team used to get the blood transfusion done. So what happened? It creates due to blood transfusion, it will uh, put oxygenated blood, and they will have more strength than the other athletes who were fatigued. Thank you. That's all.